During economic times, organisations should not cut corners on health and safety. Health and safety is there for a reason. It's to keep us compliant and also to keep our people safe. It's all about how the company perceives health and safety and whether they see it as a benefit, a true benefit to the organisation. Mental health is getting more important in industry, and I think it's time that we actually took this more seriously. The numbers speak for themselves. 1.7 million cases from the chair of the HSE talking about mental health issues. There's also stigma around males with mental health issues and how they don't want to report on those. We need to break down those borders. In my opinion, the first step an organisation should take when talking about mental health is actually identifying it and having an environment where they can talk openly about the triggers that cause mental health issues. Setting health and safety culture in an organisation is not the sole responsibility of the health and safety function. Leaders and leadership within an organisation set the culture, and the health and safety team help to guide it on the health and safety culture that you want to achieve. A lot of health and safety professionals fall into a career of health and safety following an accident for a colleague, friend, a family member, and they see it then as their personal passion to make sure people are safe when at work. We need to make sure people are aware that health and safety has a place in every workplace, and we need to persuade others to show how important that can be to have a good business. Having reduced accident rates can actually help to save money. You don't have to get people in to cover sickness, you don't have to get new people in to be trained, you don't have to cover downtime. Keep the workforce healthy, mentally and physically. Driving a positive health and safety culture across an organisation can lead to increased employee awareness and capabilities. As a health and safety leader, you should be a more rounded manager. Talk about performance, talk about people, talk about finance. Be more rounded in your approach to the overall business. Keep your safety programme relevant, keep up to date with your risks, and make sure you've got active programmes in place to address each of those risks. Taking leadership development courses may help you have that conversation with the CEO when you want to implement a cost-effective initiative, but you're going to have to spend some money to start with. All managers have a responsibility when it comes to health and safety. Yes, you're the professional, you have the experience and the qualifications, but every manager and every employee has their part to play in making it a safe workplace. When we think about skill shortages in the health and safety industry, think about who you already have within your teams. What skills do they have that are yet untapped, that you can see, but they can't? How do you mentor your people? How do you make sure they become the leaders of the future with regard to health and safety? As a health and safety leader, it's your gift to lay a path for future health and safety professionals. Giving stretching assignments to your current team members on health and safety jobs that they may not have done before may not seem important to them at the time, but in the future, they may thank you for giving them that stretch. Leaders within the health and safety industry, we have a challenge. We need to bring up the people of the future that can take over our roles in the future. When thinking about budget cuts and resource constraints, how are you going to ensure that your health and safety team have the skills and the capabilities to do the job you want them to do? Think about how you can retain staff, how you can keep your team motivated, and how you can make sure they're still up to date with all the relevant qualifications.